Good day, everyone. I am phytotherapist Yusuf Abdurrahman Folaniyi, the founder of Back to Nature. This is the second part of peptic ulcer. In the first part, I have talked about the esophageal ulcer. Now, the other type of ulcer is the gastric ulcer. So, this is the type of ulcer that occur in your stomach. So, this usually caused by one Helicobacter pylori. Helicobacter pylori. So, caused by this bacteria known as Helicobacter pylori. And this Helicobacter pylori is a very stubborn bacteria that doesn't leave that area on time. So that is, you use different kind of herbs on drugs. So it won't that won't get rid of that Helicobacter pylori. So the second thing that causes that other type of ulcer there is the NSAID, that's non-steroidal anti-inflammatory drug. So most of these pain relief drugs. So that we take, especially most of our women that are menstruating. We always feel pain. So and anybody that is feeling pain too. So most of the drugs that we usually use is this pain relief drugs. So like all these non-steroidal anti-inflammatory drugs like ibuprofen, aspirin, and some other ones. So continuous use of this type of drug like this eventually lead to ulcer. It eventually lead to ulcer. So especially the gastric ulcer. So when this ulcer now, when that place now become open like that, so anything you eat, once it make contact with that area, so it lead to a kind of pain or burning sensation. So and this opening again, even if you don't eat, if you are not eating, if that opening, so because of the fact that the blood vessel has been ruptured around that area, so that will lead to release of histamine. So when this histamine is released, so this will stimulate production of acid, production of hydrochloric acid in the wall of that mucosa of that stomach. So when this occur, that acid will now make contact. Of course, it's going to make contact with that open surface. So just imagine the open wound you have, even on your skin, not even internal, the external one, the open wound you have. When there is any contact with it, even if it is ordinary water, just think of just imagine how you are going to feel. Now, not to talk of when it is in contact with acid. So that is why even if you don't eat, the gastric ulcer or the ulcer in that stomach, so at times you just begin to feel a very sharp pain. So what is causing that sharp pain is because the acid, that place, that open wound lead to release of histamine, which now stimulates production of hydrochloric acid, and that hydrochloric acid, of course, will make contact with that surface, and that will begin it will increase the pain in that area, and eventually that place will later even become it may even lead to bleeding of that particular area, so which sometimes that person will be vomiting blood. So it depends on the stages of that ulcer in that area. So the third type of the ulcer is the duodenum ulcer. So duodenum is the point of contact between the stomach and the small intestine. After stomach, then we have the small intestine, then the large intestine. Now, the beginning of that stomach, the beginning of that small intestine is the duodenum. So any wound around this area, any opening or so around this area is referred to as duodenum ulcer. This is also caused by what is causing the gastric ulcer can also cause the duodenum ulcer. So these three of them are referred to as peptic ulcer, peptic ulcer that I earlier say in the month, as I've earlier said. So the causes of this, either the gastric ulcer, even the esophageal ulcer, as well as the duodenum ulcer, in addition to what I've mentioned, are overconsumption of carbonated drinks. So if you are the type that drink most of these soft drinks, so this can lead to to ulcer. Or if you already have ulcer, so this can aggravate the pains of that ulcer and it can inhibit the healing process of that ulcer. So lying down immediately after food, I've mentioned this earlier. So that one can also cause acid reflux, which will lead to esophageal ulcer. Then eating to fullness. So I didn't mention this one was when I was talking about the esophageal ulcer. So when you eat under normal condition, the way it's supposed to be for heaviness is that whenever you eat to two-thirds of your stomach. Both your food and the water should not be more than uh, two-thirds of your stomach. So this will give room for proper digestion, for proper mixing of that your food in your stomach. So if however you now eat to the full, you eat to the level of the esophageal, as I've shown you, as you are seeing it in the diagram. So if you look at it, due to the fact that whenever you eat, you have your food in your stomach, acid will be released for the digestion of that food. So by the time that food now fills to the esophageal valve, so that acid will make contact with that esophageal, and that will lead to ulceration. That will lead to a kind of wound around that area. So which will then eventually lead to uh, esophageal ulcer. So these are just some of the causes of this ulcer, as I've mentioned earlier. So uh, then other things that can cause, there are many other things, but these are just the common thing that causes this ulcer. Then other things are when you eat like excess food that contain too much acid, like this carbonated food, as I mentioned earlier. So or you eat too much proteinous food. So for that proteinous food to be digested, more acid have to be released. So when you eat much of protein food, so more acid will be needed to be released for the digestion of that proteinous food. So that is why most of those people suffering with this gastric ulcer always find it difficult to eat beans. Beans is proteinous food. So when you eat beans, more acid will be released. So when this happen like this, it will of course have increase the wound of that area, to increase pain there. So other food like meat and some other spices food or other proteinous food like that. So when we eat it, so this will lead to more release of acid, and which will lead to more pain is in that area. So let me quickly go to let me say the symptoms that as part of what I've mentioned that I'm going to talk about. So the symptoms is just, of course, the pain around your chest. If you are having esophageal ulcer, so that person will be feeling a kind of burning sensation or pain around that chest side. So that is why that area, sometimes if someone is feeling pains there, doctor will say you're having heartburn. So you're having a ulcer. So and mostly this ulcer around this area usually radiate to the back side. So again, you also be feeling stomach on the left side your of your abdomen. So which is likely to be that is if you are feeling pain around that area, so it's likely to be the pain as a result of that gastric ulcer. So if the pain, a part of the system is to be feeling pain immediately above your navel. That is the location where the duodenum is. So pain around that area is part of the symptoms of that of the ulcer. So also vomiting of blood too. If the blood vessel has been ruptured in the stomach, so that can lead to vomiting. So if you are stooling it too, you are seeing blood, so that can also be duodenum, as a result of a duodenum ulcer. So and many other symptoms that can be experienced for someone suffering from this ulcer. So this is the end of part 2 of peptic ulcer. So watch out for the last part of peptic ulcer, which is the treatment, the natural treatment or home remedy for the peptic ulcer. Thanks for listening. Don't forget to turn on notification, click like, subscribe, and lastly, don't forget to share for the benefit of others.